Hi, everyone. Welcome to another episode of Couch Talk. I am Dr. Tuere Coulter, founder of Family and Aesthetics Medical Centers.
And I'm Autumn. I'm the physician assistant here at Family and Aesthetic Medical Centers.
So today we are going to focus on Men's Health Week. And this is an international week that is celebrated all around the world. And the way they came up with this week is because a group of men got together and pretty much decided that all around the world that we have these discrepancies where men are not getting the care that they need, no matter what country you live in. And so there was this international push to come up with Men's Health Week. So, Autumn, with the men that come in here to Family and Aesthetics Medical Centers, what would you say are the top things that men should focus on when they're thinking about their health?
I think that there's a few ways that we should view health in general, but specifically for men, whenever they come in, there's usually something going on. But I think in order to be ahead of the curve, the best way to think about it is prevention. And so that would be coming in whenever you don't even feel bad, just so we make sure that we can get some screenings done and make sure that you actually are healthy. There's a few sectors that probably don't get as much attention in men specifically as they do others. But that would be like mental health and then physical health like heart disease and things like that. And then also, of course, like sexual interest, sexual health, things like that too.
Yeah. So let's deep dive a little bit more into prevention and what that means for men, right? And so when we're talking about our men in general, what are some things that kind of fall into that prevention category that they should be thinking about and making sure that it is done pretty much yearly?
Yeah. So that all kind of ranges based on your age. So whenever you're young and healthy, you should still come in because we should definitely get you screened for high blood pressure. We should start to screen your kidney and your heart health, and should start to just kind of make sure that everything looks good. Heart disease is popping up younger and younger. I've seen patients in their 20s with high blood pressure, and they're like high performing athletes. So just because you feel good, you're able to do everything that you can, it's just a good idea because if you don't have knowledge that you have high blood pressure in your 20s, well, by the time that you're 40s, that's uncontrolled blood pressure for 20 years, which can do a lot of damage. So just kind of getting the head of the curve whenever you're younger. And then whenever we start getting closer to 40s, 50s, then we start looking at more like cancer type prevention. So making sure that we're screening for prostate cancer, colon cancer, things that specifically have a higher rate in men too. And so, and then of course, heart disease and things like that too.
Yeah. So from a prevention standpoint, it sounds like high blood pressure screening and lab work that checks your kidneys and diabetes screening is definitely something at least once a year.
Yeah.
And then you talked about the cancer prevention. And so I did want to point out to men that there's certain ages where we start this cancer prevention, right? So like the big 4-0, like the 40-40 club is where we really start a lot of that cancer prevention. And so we think about prostate cancer starting at screening at age 40, especially in men that are quote considered high risk, so to speak. So that would be like your minority groups and things like that, definitely. And then we also think about colon cancer now. We used to talk about age 50, but that number has moved down. And so now we start colonoscopies that look for colon cancer at 45 instead. And so definitely men, if you turn 40 or turn 45, make sure to schedule your appointment so that you can get those cancer screenings done. And there's plenty of ways to do that. So you do have options. Prostate cancer screening, the blood work, the PSA can help with that. And then when you think about colon cancer screening,